Nutrition is our next most important challenge. Excess salt and calories, artificial trans fat cause heart disease, obesity, diabetes. As you all know, obesity rates have doubled for adults and tripled for children over the past few decades, and it's increasing healthcare costs, illness, and death.
The National School Lunch Program is one of the largest government-run programs in America, serving over 30 million students every day. However, concerns over the nutritional value and safety of food served in schools has created a push to make the meals healthier on a national scale this year as the Child Nutrition Act goes up for renewal. But doing so presents a challenge on multiple fronts.
I think the school lunch program, as a lot of people have noted, it's at sort of a transitional time right now. For decades, we had a focus on food sufficiency, and that's still an issue. But I think it's a real challenge right now for policymakers to grapple with sort of the twin realities of food insecurity and obesity.
Much of what policymakers are doing revolves around taking out unhealthy snack items and placing stricter regulations on the food that is served in prepared meals. However, these raised standards will come at an increased cost to schools. And unless Congress decides to set a higher reimbursement rate for meals, many schools may not be able to adopt the recommendations.
To be able to serve healthy meals, to serve more fruits and vegetables, whole grains, leaner meats, that some of the nutritional changes that we are expecting from USDA for meals, we're sure are going to cost more money.
Big picture, all these changes and regulations sound like a great idea, and they are. But once they get down to the school level, with the budget constraints and how everything has to be done, it makes it very complicated and difficult to put into practice where it'll be beneficial to students and to the school system.
Another obstacle the proposed changes presents to schools is a possible reduction in the number of students purchasing meals. Also, because many schools use pre-made ingredients to prepare meals, implementing new nutritional guidelines involves multiple steps and stakeholders.
Translate to get those things into the menu for kids to want to eat it, because the more you take the fat and the sodium and everything out of that food, the less the kids are going to want it. That's a challenge. Second of all, how are you going to get it? Because if the vendors don't have it, then how are we going to do it? So you got all these little variables to try to come up with, and it's a lot of work to come up with all these little things that they want us to come up with.
Serving meals with pre-made ingredients and keeping a la carte snack items is a matter of time and money for many schools. A la carte snack items bring in a lot of revenue that schools depend on, and using pre-made ingredients is a cheaper, more efficient alternative to cooking with fresh ingredients because it alleviates the pressures of cooking with raw food and lowers labor costs. However, although it may be cheaper, as a consequence, much of this food is low in quality and stacked with trans fat, sodium, and sugar. And when it comes down to it, does serving unhealthy food really save money?
We spend more than any other country in the world on healthcare. Right now, in 1990 it was about 9% of our GDP. Now it's 16%. If we don't do something, just in about 15 years, we'll be up to 1/4 of our whole gross domestic product will be on healthcare. We can't afford this.
We have a situation where if we don't address this issue now, we're going to actually raise the first generation, many experts say, of young people who will live sicker and shorter lives than their parents.
I think we have an opportunity now to take a generation of American kids and teach them how to eat, because you can spend $2.68 on school meals right now and allow junk food in schools And the number of Americans with chronic diseases is just going to keep on rising. And we're going to keep on just spending exorbitant amounts of money on healthcare. Or you can make an investment now.
The reauthorization of the Child Nutrition Act and what is done independently present an opportunity to improve the quality of food served in schools across America. This will not be easy, and to undertake the challenges it presents will require investments of time, energy, and money.
It's like saying, why should we spend money on math and science? Why should we spend money on computers in school? Why should we spend money on arts? I think, and it's now clear, that that quality nutrition and good food are just as important as math and science for the life of our kids, life of future citizens of our nation.
Changing the way America eats is going to be part of saving money on healthcare. We're just going to have to change the way we eat. And, you know, one of the best ways to do that is to start healthy eating at a young age. And we have tons of young kids coming into schools every day. You know, what better place to form healthy eating habits than public schools?
We serve about 31 million lunches every single day to kids across the United States in over 100,000 schools. So the point there is the reach of these programs is significant. So they really do provide an opportunity and a platform to do something positive for the health and nutritional quality of children in this country.
So yeah, schools ought to be always at the forefront of positive change. Where else? Where else? You know, if not schools, where should we start?